Hello everybody. My name is Louise Lindenmeyer and I'm a family nurse practitioner and I work at Hudson River Healthcare, and I'm going to be speaking to you about prevention and treatment of cervical cancer. So the first question we might ask is, what is cervical cancer? Is a cancer, which means it is abnormal growth that happens on the cervix. And the cervix is the very opening of the womb. It is a cancer that years ago was the most common female cancer. But now with different innovations, including the well-known Pap smear, and then following after that, the HPV test, and beyond that, the HPV vaccine, we have lowered the cancer rate substantially. HPV is a virus, and it's the virus that causes cancerous changes to the cervix. It also, by the way, can cause genital warts and other wart-type lesions in other parts of the genitalia. First, you may have heard about the HPV vaccine that's given to children when they reach the age of 11. Both boys and girls. This is a voluntary vaccine. It's not required by the schools, but it's a series of 2 if you start early on, and that really protects the child from HPV. Then there's the well-known Pap smear, which we do not begin to do until the woman is 21 years old, and that is a speculum exam. It involves a pelvic exam where we take a kind of a smear or a scraping of the discharge on the cervix and send it to the lab. That is also followed by HPV screening, which we do not begin generally until the woman is 30 years old. And that is the same kind of mechanics as a Pap smear. The timing of these tests are very important and controversial because they have recently changed. Many people were used to getting a Pap every single year. Now that has extended out so that for women in their 20s, they only need to get a Pap test every 3 years if it comes out a negative. And for women over 30, they only need a HPV test every 5 years and until they're 65. You may say, oh, well, maybe I don't need a Pap smear. I don't need cervical screening because I feel fine and my periods are normal and I have no pain. Well, unfortunately, cervical cancer really has no symptoms until it's quite advanced, until it's too advanced to do any simple techniques of treatment. What happens if my Pap or my HPV test comes out positive? What do I do? Sometimes you just need to wait a year, because one interesting thing is young women in their 20s often are able to clear the HPV virus on their own with their own immune system. But if it doesn't clear by the time they're 30, or if it keeps coming back positive when they get PAPs a few years in a row because of positive findings, then you get a colposcopy, which is a highly magnified view of the cervix, and then a small little piece, a sample, is taken and sent to the lab to see how that pans out. If the results are positive for pre-cancerous changes, you would either have your cervix temporarily frozen, which you can't really feel, or a little bit of a surgical excision of a little piece of the tissue that's suspicious. Neither of these treatments would affect your fertility, so anybody having these procedures would still very easily be able to have babies. In all of the New York counties, I believe, there is Cancer Services Program, which protects women and covers the expenses of a PAP or cervical screening and mammogram for women of a certain age. Of course, that's 40 years old. and beyond, but it's still a great service. Also at Hudson River Healthcare, we have very inexpensive fees for the consult, as well as the lowest lab fees that you can find. Don't forget about Planned Parenthood and family planning. They will do the same kind of cervical screening for you on a sliding scale. So let's stay healthy.